Educating nurses. Naloxone. Naloxone. Naloxone is an opioid antagonist. It is given in the event of an opioid overdose. Injections are given IM through patient's clothing, and up to 3 doses of medication can be given. A naloxone kit contains. A naloxone kit contains the tools necessary to help someone in the case of an overdose. The kit contains a naloxone checklist that should be filled out after an emergency, 3 ampules of naloxone, 3 Vanish Point intramuscular needles that will be used to administer the medication, and after the needles have been activated, they will retract for safety. A pair of gloves. A breathing mask that should be used to provide rescue breaths. Follow the indications on the mask to identify the proper directions for use. Finally, the kit contains an alcohol swab. Signs of an overdose. Respiratory depression and/or apnea, decreased LOC, cyanotic mucous membranes and nail beds, cold, clammy skin, and pinpoint pupils. The Save Me acronym. S. S stands for stimulate. Check the patient's LOC. Shake and yell. Do a trapezius squeeze. Do a sternal rub or roll a pen over the nail bed. Are they unresponsive? Then call 911. A. A stands for airway. Assess the airway patency of the patient. Maintain an open airway. Do this via a head tilt and a chin lift. V. V stands for ventilate. Use the mask provided in the naloxone kit. Give breaths. Give them 5 seconds apart and give them continuously. E. E stands for evaluate. Evaluate the patient. Check their LOC. Check their ABCs. Are they breathing? If they're not breathing, you need to prepare naloxone. M. M stands for medication. Give 1 milligram of naloxone IM. This is 1 ampule. This video will demonstrate the proper way to administer naloxone. Open the naloxone ampule. Draw up the medication. Give the medication into the vastus lateralis. This is the preferred site. The injection should be given through the patient's clothing. E. E stands for evaluate and support. Evaluate the patient after 3 to 5 minutes. Assess their LOC and their ABCs. Give a second dose of naloxone if needed. Continue to give breaths. Repeat. Repeat the acronym as needed for subsequent naloxone doses. 3 doses are included. Always stay with the patient. If you have to leave the patient, place the patient in the recovery position. Important facts about naloxone. The drug effect of naloxone is 30 to 90 minutes. However, the drug effects of opiates last about 2 to 9 hours. This is why transport to an emergency department is essential even if the patient is awake and alert after receiving a dose of naloxone. They can overdose again when the naloxone wears off. A review. S stands for stimulate. A stands for airway. V stands for ventilate. E stands for evaluate. M stands for medication. And E stands for evaluate and support. Student demonstration of learning. Can you tell me what is in a naloxone kit?
So inside the kit, I will find the instructions, the overdose information form, 3 naloxone ampules, three needles, pair of gloves, face mask, as well as an alcohol swab.
What are 3 signs and symptoms of an opioid overdose?
So the 3 signs of overdose is decreased level of consciousness, decreased respiration or no respiration, and pinpoint pupils. So I'm going to check for level of consciousness. Hello, hello. Nothing. Check for sternal rub. Nothing. I'm going to check for respirations. Nothing. And also check for pinpoint pupils.
What does SAVE ME stand for?
The SAVE ME acronym, S is for stimulate, A is for airway, V is for ventilate, E is evaluate, M is for medicate, E is evaluate and support.
Can you show me how to administer naloxone into the vastus lateralis?
So I'm going to open the ampule, break it away from your body. Now I'm going to drop 2 milliliters of naloxone. I'm going to scrub the patient's outer thigh vigorously, but if they are wearing pants, then we just inject through the clothing. Engage the safety.
Can you tell me why it is important to carry a naloxone kit?
I carry a naloxone kit because I live downtown.
I carry a naloxone kit because I always want to be prepared.